The lawmakers, guys, in the House of Representatives and the Senate are going to guarantee a boost in benefits for Social Security beneficiaries at least. Monthly checks may be increased by at least $100 soon. Lawmakers in recent days took the first steps in ensuring that veterans actually receive a cost of living boost, everybody. That's in their federal benefits later this year, folks. And introducing legislation that would guarantee the veterans' checks see the same increase as Social Security payouts. So guys, this measure was filed by Representatives Elaine Leoria and Troy Niles. Senators John Tester and Jerry Moran have also shown their support for the bill. In joint statements, the four called the proposal critical to bolstering veterans' finances. The senator ranking member of the Senate VA committee said, "We have responsibility to take care of our veterans, many of whom rely on VA for financial support. As rampant inflation is driving up the cost of living, this legislation makes certain that veterans are able to keep up with our changing economy and receive the benefits they have been promised." The legislation linking the two government benefits is largely routine. Typical lawmakers approved the annual proposal to couple VA benefits increases with Social Security benefit increases by large bipartisan margins. But it is automatic. Despite efforts by some advocates in the past, an annual cost of living increase in veterans' benefits requires congressional action. Social Security benefits, on the other hand, are adjusted based on automatic formula that is triggered when lawmakers vote on it or not. Last year, as inflation pressures began to impact the economy, that increase was 5.9%. Officials have not said what this year's adjustment may be, but continued rising costs across the economy could drive that figure even bigger. The VA COLA increase legislation would apply to payouts for disability compensation and other Democratic VA assistance programs. However, much of the higher COLA could be eaten up via Medicare premium increases, which typically also rises each year. For instance, the standard cost of Medicare Part B jumped 14.5% to $170 per month in early 2022. That's an increase of $21. Seniors saw a chunk of their 2022 COLA increase gobbled up by that higher cost. What are your thoughts on this, everybody? Tell me in the comments below. For many Americans, though, the crisis-induced shutdown offered a rare opportunity to better their financial standing. Government stimulus checks and fewer opportunities for spending drove the personal savings rate to a level not seen in many years, with many consumers using the extra cash to pay down debt, primarily their debit card and credit card balances, which have the highest interest rates. Although consumers paid off a record $83 billion in credit card debt during the crisis, the recent spike in price of gas, groceries, and housing, among other necessities, is causing people to return to running up high balances on their cards. The Federal Reserve's monthly credit report found that the revolving credit, which mostly includes credit card balances, jumped 20% in April from the previous month. Meanwhile, credit card balances are also up year over year, reaching $840 billion in the first 3 months of 2022, and are expected to keep heading up higher. The rise in credit card borrowing, together with auto loans, student debt, and mortgages, has now propelled total household debt to a record of $15 trillion. The downside for consumers is that credit cards are one of the most expensive ways to borrow money.
Median price for new brand name prescription drugs. In other words, about half of all new brand name prescription drugs approved by the FDA are beyond the imagination of what normal, ordinary income people can pay. Now, how does this happen? And this gets to a very important point that we don't discuss, I think, enough either here as well. And that is that maybe this reality of the pharmaceutical industry charging outrageous prices and getting approved by the FDA has something to do with the fact that 73% of the FDA's budget to regulate the pharmaceutical industry comes not from the taxpayers who want lower cost prescription drugs, but from the industry itself. All right, so the industry, in a sense, is regulating itself. May make sense to somebody, not to me. Madam Chair, we should be clear, and sometimes we forget about this, that the mission of the FDA, and let me quote it exactly, quote, FDA is responsible for advancing the public health by helping to speed innovations that make medical products more effective, safer, and more affordable. That is one of the missions of the FDA. And yet, whether it is a Democratic nominee for the FDA commissioner or a Republican, we really do not see that as a particularly high priority. To To correct these fundamental problems, I have filed 4 amendments, which I would like to bring up for a vote, Sanders 1, 2, 3, and 4, to this bill. The first amendment that I filed would allow wholesalers, pharmacists, and patients to purchase safe and affordable prescription drugs from Canada and the United Kingdom. After a 2-year period, the FDA would be authorized to expand this program to other OECD countries. We have talked about reimportation for a zillion years. This bill actually does it. Doesn't wait for somebody in the bureaucracy to make it happen. We mandate that it happens. Second amendment would essentially make sure that the price of prescription drugs in America does not exceed the median price in 5 major countries: Canada, the UK, France, Germany, and Japan. By the way, this is something that Trump, you may recall, talked about as well. All we are asking for is this country not to pay prices higher than exist all over the world. I don't think that's a particularly radical idea. It would lower prescription drug costs in America by 50%. Go home to your districts, go home to your states, and ask your constituents whether you think that's a good idea. I think they will tell you it is. The third amendment would essentially prohibit the FDA from approving new brand name drugs if they are not reasonably priced. What is the sense of approving a drug that costs hundreds of thousands of dollars if nobody can afford it? I don't know what that is about. Fourth amendment would simply require the Government Accountability Office to conduct a study within 1 year on how many Americans die because they cannot afford to purchase the medicine that their doctors prescribe. 1 out of 4 Americans cannot afford the medicine their doctors prescribe. How many of them are going to die? I suspect many. Let the GAO find out about it. Madam Chair, I think we have got to be clear and not fool the American people because they're tired of this discussion. It is not Congress that regulates the pharmaceutical industry. It is the pharmaceutical industry that regulates the United States Congress, which is why we are where we are today. Since 1998, the pharmaceutical industry has spent $5.1 billion on lobbying and over $535 million on campaign contributions. How's that? $5 billion. Right now, here in Washington, they have 1,500 paid lobbyists, former leaders of the Republican Party, former leaders of the Democratic Party, working overtime to make sure we don't represent our constituents who are dying and sick and tired of paying outrageous prices. Now, we can go on and talk and talk and talk. That is the reality. Do we finally have the guts to stand up to the most powerful lobby? And let me give you another example of how absurd and disgusting this situation is. A few years ago, the CEO of Moderna, I'm mispronouncing his name, I'm